everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about documentation, as we've also discussed in detail about what reporting and recording is and what are its purpose, in today's session, we are going to discuss about the communication within the healthcare team. So as we all know that communication is the process of exchange of information. Communication is the process whereby all the ideas, all the thoughts, feelings will be shared, will be communicated from one person to the other, right? So here it is very important that being in a healthcare team, it is very, very important that there must be a good coordination as well as a cooperation and a good communication between them. Why? Because here each and every individual who is a part of that team has their own role to perform, right? Each and every individual has their own role which they will be doing for the client so that they will be able to help them improve their health. So no matter what care you are providing, no matter what treatment you are providing, it is very important that there must be a good communication. It is very important that this must be communicated, as well as it is very important that all of these must be communicated to all the healthcare team members. And these medical errors sometimes can also be very dangerous, as it can lead to severe injury or even to the death of the patient. So here, in order to have an effective communication, we can use the two approaches, that is the reporting as well as the recording. So here, as I have discussed in the previous session about what recording is, right? So we've come to know that recording is a permanent written documentation whereby everything which is performed for the client will be present, ranging from their name, their age, their medical history, their diagnosis, any surgical history, and even any treatment or procedures which has been performed for them will all be documented. And not only that, even all the lab results will also be present. Whereas reporting is the process whereby there will be a verbal communication, where there will be a verbal exchange of information. This reporting usually occurs for nurses, especially when it is the time where the nurse will be changing their shift with the other nurse, right? So here, before she gets relief from the duty, it is her responsibility to report about the condition of the client, to report about what are the various treatment that still need to be followed for the client, for the other nurse who will be coming and who will be taking charge of the client. Now moving on to the next one, that is the information exchange strategy. So here there are a number of tools and strategies which we can follow in order to reduce any errors that can arise because of lack of communication or even the miscommunication. So in order to prevent this miscommunication and this lack of communication, there are, the various strategies which we can integrate it with our daily practices, and also these strategies have proved to be very, very beneficial for the healthcare team. Why? Because these strategies not only help to improve the condition of the client, but it also helps to improve the team performance. So there are 4 strategies. The first one is the SBAR, where S stands for situation, B stands for background, A stands for assessment, and R stands for recommendation. Then the next one is the call out, the third is the check back, and the fourth is the handoff. Now let's look at each one of it in detail. So let us start with SBAR, which means situation, background, assessment, and recommendation. So this SBAR is a framework communication between the members of the healthcare team about the condition of the client. So as I've said here, that this SBAR is a framework whereby the members of that particular healthcare team will be communicating with each other in order to share the information about the client's condition. So here they'll be communicating about the client condition, they'll be communicating about the treatment which has been provided, they'll be communicating about various procedures which needs to be done, and also the outcome that the client has, experienced through the procedures or the treatments which has been followed till date. This SBAR is also a tool which is very easy to remember in order to frame all the conversation, especially the one which is critical and the ones which require immediate attention and action. So here this SBAR is a tool whereby it is very easy to remember, especially when we are framing any conversation that is critical, okay? Especially when it is about a critical condition whereby an immediate attention and immediate action is required. This SBAR is also an expected as well as a focused way of setting any expectation between the members of the healthcare team for what will be communicated and how. Not only that, but it also helps to develop the desired critical thinking skills. So we've discussed about SBAR in general. Right now, let's look at each one of it in detail. The first one, which is the situation. Situation here means the situation that had occurred, for that particular client. So here, what you will be doing is you will be communicating to the healthcare team about what is happening to that particular client. So the first thing what you as a nurse will be doing is that you will be introducing yourself and from which unit that you are communicating to that healthcare team member. Introducing yourself as well as you will be telling from which unit are you calling from. And the next thing is you will be identifying the patient by their name as well as the reason of why you are reporting about them. And the third one is that you will be describing your concern. So as I've said here, that S stands for situation, right? Means what is happening to that client. So in case of anything had happened to the client, what you will be doing as a nurse is that first you will be identifying, you'll be introducing yourself, and then you will be telling them from which unit you are calling or you are contacting them. And after this is said, then the next thing is you will be identifying the patient and you will be telling your reasons for that particular report. And after that is done, you can describe your concerns. So here, for example, as you have witnessed what is the condition of the client, what is the situation that the client is in. So while you are reporting, you can also describe your concern for that particular client. The next is B, which stands for background. So here what you will be doing is you will be wanting to know the clinical background, right? So here the first thing that you as a nurse will be doing is you will be giving the patient the reason for their admission. So here it is very common that before you admit the client, you must always tell them the reason for why you are admitting them and what are the various things that, you will be performing for that particular client that will help them to improve their health. The second is to explain their significant medical history. So here again, as I've told that before we admit the client, it is very, important that we must explain the reason behind their admission, right? So here, you as a nurse will also be explaining the significant medical history as you'll be explaining what is their disease condition, what are the treatments which they require, and what are the various procedures or the various methods they can adopt in order to improve their health. So here, while you will be explaining the reason, while you will be explaining them about their condition, there will be a lot of information which you will also be collecting from that particular client. So here, after all these things has been performed, the next thing you as a nurse must do is that you must inform the consultant of the patient's background. And then here the next thing, that is A, which stands for assessment, right? So here what we as nurse will be doing is that we will be assessing the condition of the client, right? So here while we are assessing the condition of the client, it is also very, very important that we must assess their vital signs, their contraception period, as well as their clinical impression and their concerns. So here while we are assessing the condition of the client, it's very essential that we must not only assess their disease condition, but also their whole health status so that we get an idea of what the condition is suffering from, but their whole health status so that we get an idea about what are the various things that the client is suffering from, what is the condition of the client, what are their signs and symptoms, what are the complications that, can arise for that particular client. And we must also make sure that we assess the vital signs. Why? Because here vital signs is very important as it is the basic indicator of the client health status, right? So here you will be assessing the vital signs. You will also be assessing their concerns as well as their clinical. And then the next one here is the R, which stands for recommendation. So recommendation, as a nurse, what you will be doing is that you will be thinking of what are the various things that you would like to recommend for that particular client. So the first thing what you can do here is you can explain your needs. And whenever you do it, you must make sure that you must be very specific about the request as well as the time frame. And the next thing you can also do is that you can make suggestions, you can clarify the expectations, And then only after all of these things is done, then you can finally make your recommendation. So this is what SBAR means. Now moving on to the next one, that is the call out. So this call out is a strategy which is used to communicate any critical information during an emergent event. So here this call out is usually done when any critical information about the client needs to be communicated, especially in an emergency event. And this information is usually directed towards a specific individual. So here, from the name itself, right, call out, we can understand that it is directed to one particular individual. So here, this is usually done if any critical information about the client is to be communicated, especially when it is, related to any emergency event. So if this situation occurs, then we can follow this call out strategy. And the next one here is the check back. So here, as a nurse, it is very important that you must always reassess, you must always recheck before you do anything. So here, for example, if one member of the team calls and say that the BP of that particular client is falling, if he says that now the BP is 80 to 48, whereas before it was 90 by 60, right? So even after you have heard this, as a nurse, you must make sure that you check back. And how you can do this? You can do this by repeating or by restating what they have said. Like here, as I've told you an example, right? That the member of the team had called and said that the BP is falling. Now it is 80 by 48 from 90 by 60. So what you will be doing is that you will be saying, okay, so the BP of this particular client is falling. Now it is 80 to 48 from 90 by 60, right? So here in this manner, the nurse will be able to check back that whatever information has been communicated to her has been interpreted the same way as she has, expected it to be. And then the next strategy is the hand-off strategy. So here, this hand-off strategy is used especially when a team member is temporarily or permanently relieved of the duty. So here, since this team member is the one who has been taking care of the client, right? So here, when she relieves her duty and when she hands over her duty to the other nurse, there is a risk that the necessary information about the particular client may not be communicated. That is why this handoff strategy is designed in order to enhance the communication exchange at critical times such as transitions in care. And most importantly, it is through this handoff strategy that it maintains the continuity of care despite the changing caregivers. So this handoff strategy can be applied when a team member who has been taking care of the client is temporarily or permanently relieved from her duty. So when she needs to hand over her duty from herself to the other nurse, it is very important that she makes use of this handoff strategy. Why? Because when she hands over her responsibilities, her duties, it is very essential that she must, communicate all the information about that particular client, right? So here, when she is doing so, there is, a risk of the necessary information which may not be communicated about that particular client, right? But through the use of this handoff strategy, she will be able to communicate all these things effectively. Why? Because this handoff strategy enhances the information exchange at the critical times, especially during this handover. And most importantly, it also maintains the continuity of care despite of changing of the caregivers. So here, the primary objective of this handover is nothing but to provide an accurate information about the client's disease condition, about the client's treatment, and if any recent and any anticipated changes can occur. The information which is also communicated through this handoff must be accurate in order to meet the patient's safety goals. So as nurses, when can we use handoff in our unit? We can apply this strategy when there is transfer of responsibility and clarity of information, when there is opportunity to review, as well as when there is verbal communication of information and any acknowledgement by the receivers. So these are the four strategies that has been found simple to integrate into the daily practice and has also proved to be beneficial for the team performance. However, there is one more strategy that is known as I pass the baton. So here each and every letter has its own meaning. The first one is I. So here I stands for the introduction. So here as a nurse, it is very important that whenever you are in charge of taking care of the client, you must make sure that you first introduce yourself as well as the role which you will be performing in order to help them improve their health. And the next one is P, which stands for patient. So here as a nurse, after you have introduced yourself, it is also very necessary that you must get an introduction from the client. You must know the name of the client. You must know the age, the sex, the location, the diagnosis, and all the information which is related to that particular client. And A here stands for assessment. So here it is very essential that you must assess the condition of the client. You must assess their vital signs, their symptoms, as well as their diagnosis. And the next is S, which stands for situation. So here as a nurse, it is very important that you must know the situation in which a client is in. So in order to get an idea about this, you should know their current health status, their level of uncertainty, their response to treatment, as well as if any changes had occurred to the client. And then again, another S, which stands for safety concerns. So here as a nurse, it is very important that you must know about their critical lab value, their reports, their socio-economic factor, their history of allergies, as well as their health alerts. And then B. B here stands for background. So here as a nurse, it is very important that you must know the client's clinical background. You must know about the comorbidities, about their previous episode, their current medications, as well as their family history. And then A, which is the action. So here as a nurse, you must also know what are the various actions that had been taken for that particular client, which means what are the various treatment which has been provided for them, what are the various plans that a nurse has already performed and had planned for them. And not only the actions which has already been performed, but here it is also responsibility to find out if, any other new action needs to be performed in order to improve the client health status. And the next one here is T, which stands for timing. So here as a nurse, you must also know the timings of the medication which needs to be provided for them. You must know the timings of their food. You must know the timings of the procedures which needs to be performed for them. And then O, which stands for ownership. So here you must also know who is the responsible nurse, the doctor, or the team. And you must also include the patient and the family members in the responsibilities which, can help them improve their health. And the last one here, which is N, that stands for next. So here, after you have assessed the condition of the client, so, you can find out if they require any modification, if they, can still stick on to that same plan. So through this next, you will be able to get an idea of what will happen next, what are the modifications that needs to be done, as well as what are the next plan for that particular client. So these are the various things that, you can perform when you are using that I pass. So these are the various things that you can perform when you are using this strategy, that is the I pass the baton strategy. So now here we have come to the end of this topic. So in today's session, we have discussed about the communication within the healthcare team. We have discussed about the 4 strategies which we can apply that has also proven to improve the team performance. That is the SBAR, the call out, the check back, as well as the handoff. And at the end, we've also discussed about one more strategy, that is the I pass the baton strategy. And I also hope that through this topic, you nurses will be having an idea of what are the various strategies you can adopt in order to have a good communication with the other healthcare team members. So I will be meeting you guys in the next session. Until then, have a good day. Thank you.